Hair loss is one of the most well-known side effects of cancer treatment and can be a worry for a lot of patients about to undergo chemotherapy. However, chemotherapy does not always cause hair loss. Some drugs cause only slight thinning and others do not cause any hair loss at all. In fact, there are a number of factors that will determine the likelihood of hair loss, which include the type of drug or combinations of drugs you are taking, the doses, your sensitivity to the drug, and some drugs you have received in the past. If your chemotherapy causes complete hair loss, your hair will usually start to fall out within 2 to 3 weeks of starting treatment, and hair loss is usually gradual rather than sudden. However, this is dependent on the type of treatment. Some chemotherapy drugs can make hair from other parts of your body also fall out, such as your eyelashes, eyebrows, underarm, leg, and sometimes pubic hair. So think about buying cosmetic products to help cope with losing your eyebrows and eyelashes. There are things you can do to limit the loss and help you prepare for losing your hair. But bear in mind your experience will be unique to you. Talk to family and friends about losing your hair. You also might find it helpful to talk to other people with hair loss and share experiences and tips on preparing for this and coping. For example, think about having your hair cut short before or shaved off completely before your treatment starts. If you're thinking about wearing a wig, choose one before you start your treatment if you want to match your current colour and style. Some procedures are available to help reduce the amount of hair loss with chemotherapy. For example, scalp cooling works by lowering the temperature of the scalp, reducing the blood flow, which decreases the amount of chemotherapy drug that reaches the hair follicles. Discuss this option with your treatment team, as it may be worth considering. But be aware that scalp cooling is only effective with certain chemotherapy drugs and does not work for everyone. It also means that the stay in the unit when receiving chemotherapy will be longer. It is important to look after your hair and skin during and after cancer treatment. Wash it at least once every 2 days. Use gentle hair products. Pat your hair dry and use a soft brush or wide-toothed comb. Avoid using hair dryers, curling tongs, curlers, hot rollers and straighteners. Use an unperfumed moisturiser if your scalp is itchy or flakes. Protect your head from sun and cold. Wear a soft cap, net or turban at night. Your hair usually grows back once your chemotherapy treatment is finished. It usually starts growing back 3 to 6 months after treatment at the same rate as it did before chemotherapy. As your hair grows back, it may be different. For example, curlier, straighter, thinner, softer, patchy, or a different colour. You should have a good head of hair 4 to 6 months after your treatment ends. As your hair grows back, use gentle shampoo and hair products that don't irritate your scalp. Before you colour or perm your hair, seek professional advice. Your hair and scalp can react differently, so a professional hairdresser needs to do a test to check that any chemicals will not damage your hair or cause an allergic reaction on your scalp. In very rare cases, the hair does not grow back, but usually this only happens with high doses of particular drugs. Speak to your doctor or nurse to ask if the drugs you are receiving are likely to cause hair loss.